As you know, this week, Michigan's air quality is among the worst in the nation. Smoke from wildfires in Canada is causing all that haze and potential health concerns for those who stay outdoors for too long. Joining me now with what you can do to protect yourself is Senior Vice President and Chief Medical Officer at Blue Cross Blue Shield of Michigan, Dr. James Grant. Doctor, always great to see you.
You too, Michelle.
So the potential harm that we're breathing in, all these airborne particles right now, what can we expect?
It's not good. I don't know about you. I went outside, went to go in the car today, and as soon as I walked out of the house, it was like, whoa, it was like hazy. It smelled like it just smelled like smoke. What can we do? I mean, we got to make sure we stay in the house as much as we can right now. This is something in the Midwest and in Michigan. We're just not used to it. Other parts of the country get these kind of fires routinely. They're used to it. We're not. So what do we need to do? We need to be really particular. We need to make sure like kids and older adults stay out of it. Those with lung or heart disease, so especially if you have like emphysema, or especially if you have asthma, or what we call COPD, stay out of it. Stay out of it until this clears up. It's not good. You know, even when you're driving, you can smell it, you can see it. And if you don't have to be out, don't go out.
All right, so if we do have to go out, though, how do we protect ourselves? Because I know a lot of people still have masks left over from the pandemic. Will those work?
Yep. So, Michelle, when I got out yesterday and I took a look and I smelled it, I walked right back in the house and I said, let's crack out the masks from the COVID. And that's what we did. And we still have had a couple N95 masks. If you've got N95 masks, bring them out. It's not perfect, but it really will help keep some of those particles out of your lungs.
Okay, good. You know, we were talking here about some of the symptoms that we've been feeling. A lot of people say they have headaches. Some people mention a little sore throat. What other kinds of things should we be looking for?
Michelle, you can have coughing, wheezing, especially if you're already an asthmatic. A lot of irritation to your eyes and your nose and your throat. A lot of people talk about headaches. Some people talk about nausea. A lot of dizziness you can get. Remember, your blood oxygen levels are going down. Fatigue, you can get tired smelling it. So it's really, 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 I can't emphasize how important it is to stay out if you can.
Yeah, no, that is good advice. A lot of people mentioning just feeling a little bit off, so that would make sense with all of this. And if we do have more of these days throughout the summer, then are we looking at long-term risk from this?
You know, long-term risk, but it would have to be very, very long-term. It has to be like every day for months. I don't think, hopefully we'll never be at that point. It's something that, you know, we got to get through this. But we have to be very, very careful right now. We have to really be sure. We're not used to being inside in the summer. This is a first for us in Michigan.
Yeah.
We need to be inside now. You know, we need to be inside. You know, if you have air conditioning, turn it on. Just stay out of it's just polluted air right now.
Okay, all right, some extra precautions. All right, Dr. Grant, thank you so much. Great advice as always.
Thanks, Michelle.
We do like to be outside in the summer. I want to show you yesterday's high-definition satellite imagery, and you can see the heavy smoke plume. This is today's. By contrast, you can actually make out the mitten a bit. Coming up, we're going to be talking about more smoke moving in for Thursday and finally fading for Friday.